Good morning, everybody. I'm Azadeen. I'm one of the foundation doctors currently in the UK. To let you know about our website, which is PLABverse, helps the PLAB candidates, the PLAB 1 candidates, get a reliable material for PLAB 1. And we have a new service which is actually explaining each chapter of the PLAB and providing Q&A sessions on each topic of the PLAB 1 questions, all delivered by NHS doctors like myself. Today we were thinking which topic would be of interest for new candidates to the PLAB pathway in general, and we agreed that it would be a good idea to talk about the ethics. Our agenda for today will include the following. First, we'll talk about some ethical dilemmas in the practice. We'll talk about issues around consent in young patients. We'll talk about confidentiality, and we will know what Fraser guidelines is. We'll talk about mental capacity and patient's decision. We'll talk about important terminology that you should be familiar with. And finally, we will discuss together real exam scenario. When you talk about the ethical dilemmas in the practice, one of the most common things is terminating the pregnancy point of view. So if we are talking about a vaginal delivery, imagine a fetus is distressed and we need an emergency C-section for him or her, but the mother refused to have a C-section. So what would you do? Respecting the patient's wishes is the most important thing, provided one thing, that the patient is competent. What's meant by competent means that the patient has capacity to make her own decision. In the UK, the fetus doesn't have any human rights until born. Also, one of the ethical dilemmas when it comes to the pregnancy is the termination of the pregnancy. Before 24 weeks, it is legal. After 24 weeks, it is not legal. After 24 weeks, it is your medical decision, and it should be based on any risk that will be imposed on the mother if the pregnancy continues. Another ethical dilemma, which was about the Jehovah's Witnesses. It's a belief that some people have. In this belief, it is not permitted for them to have any blood transfusion or any blood product. In this case, the correct thing to do is not to transfuse any blood or blood products. And the only thing you can do in this situation is the intravenous fluid. Danger his life. So if it is emergency and the parents refuse, you should give the blood transfusion. If it is an adult, and even if it is an emergency and the patient is competent and refuses the blood transfusion, you should respect their wishes. So accepting gifts or accepting valuable gifts is not accepted at all from patients or colleagues. And by valuable gifts, we mean £100 or more comes in the exam like this. And the money itself, if the gift is in the form of money, so it's not accepted at all. This is another ethical dilemma, which is how to escalate an issue involving your colleagues. That if you had noticed any issue that's involving your colleague, you should confront him or her first, and then involve your seniors if needed, and you can escalate up to the level of GMC if the matter is that important. Back to the consenting, and the most important thing in ethics is the consent, and you need to understand what consent means. We said any competent means able to understand and make informed decision. Note that ability of consent changes if you are under 13. By law, children under 13 are considered unable to consent. If a caregiver is requesting for his or her child to undergo potentially life-threatening procedure that he or she doesn't need, contact social services and explore their concerns. So parental consent, which is the consent of the parents on procedures or treatments regarding their children. If a parent refuses to give consent to a particular treatment, this decision can be overruled by the court if the treatment is thought to be in the best interests of the child. By law, healthcare professionals only need one person with parental responsibility to give consent for them to provide treatment. So if your patient is young and too immature to understand the consent, you shouldn't take her word. You shouldn't give her contraception. You need to make sure that this is a healthy relationship with the other, and the young girl understands everything about what's going on, and she wants the contraception. So the right thing to do is to give her the contraception, give her advice about how to practice safe sex and prevent the sexually transmitted infections. And you can encourage her to include and involve her parents, but you cannot force her. And of course, you cannot break her confidentiality and go to tell the parents. An act done or decision made under the act for or on behalf of a person who lacks capacity must be done or made in his best interest. And before the act is done or the decision is made, regard must had to whether the purpose for which it is needed can be as effectively achieved in a way that is less restrictive of persons' right and freedom of action. We have what's called DOLS, which is deprivation of liberty safeguarding. It protects the patients who lack capacity from abusing this lack of capacity. The whole concept that I want you to remember from this presentation is the concept of respecting the patient's consent. The other thing and the other rule that will guide you is the patient's safety. So what will help protect this patient's safety, you will do it, and what will endanger the patient's safety, you will try to prevent it.